Hi, my name is Tori and I am a doctor of physical therapy specializing in pelvic health and pelvic floor dysfunction. One of the topics that I discuss a lot with my patients is vaginal health and hygiene. Good, healthy habits for taking care of your vagina. What's good for the vagina, what's not as good for the vagina, and how to keep the vagina happy, healthy, and clean. Often when I get questions about this, it's paired with a more specific question like, should I douche? Is it okay if I use vaginal wipes? What about vaginal deodorant? The short answer is no. Your vagina is amazing and it does not need you to douche, it does not need you to use vaginal wipes, it does not need you to scrub really hard with soap and water, and it does not need you to spray it in order to keep it clean. But my intention in making this video is to really dive into the details as to why you don't need to do all these things to clean your vagina and explain better, healthy vagina habits. I want to be very specific with the terminology that I'm using. When I refer to vagina, I mean the actual vaginal opening, the vaginal canal, the mucosal lining around it. And when I talk about vulva, I mean the skin surrounding the vaginal opening. I'm talking about the outer and inner lips of the vagina, labia minora and labia majora. I'm talking about the skin around the vagina, the vulva. So let me show you what I mean. I drew this picture, you'll have to forgive my art here, but essentially, to orient you, this is looking up towards someone's head, and we are looking at the vulva and the vagina. So, in pink, we've got the actual vaginal canal itself, the vagina. Above it in orange, we have your urethral opening. The urethra is the tube where the bladder connects and urine flows from the bladder through the urethra and then out when you pee. And then right above the urethra, we have the clitoris. So you can see here the true inside of the vulva. We've got clitoris, urethra, and the vagina. And then the two lips here, this is labia minora, this is the smaller inner lip. And then the bigger lip is called labia majora. That's the outer bigger lip. And then right below, we've got the anus. So when I talk about the vagina, I'm talking about truly the vagina. And when I talk about the vulva, I'm talking about the outer skin, okay? So let's first discuss how the vagina actually cleans itself. It creates its own natural secretions that we often refer to as discharge. The vagina is a fascinating self-cleaning oven. It already has the glands that it needs lining the opening that create not only that cleansing discharge that we were talking about earlier, that cleansing vaginal secretion, but it also creates its own lubrication with these glands as well. So these glands make sure that your vagina is well lubricated and clean every day, all on their own. This is going on inside of you without you being very aware of it at all, except for when maybe you feel some of that discharge. Something else that's really important to know about your vagina before we talk about cleaning it, now that we know that there's glands that exist that clean it and lubricate it, we also need to talk about the bacteria that exist within the vagina itself. There are some really healthy, important, good bacteria that live naturally within the vagina, and they have a lot of really important roles. But just to name a few, one is you want there to be more of this good bacteria than there is bad bacteria. You want the good to outnumber the potentially harmful bacteria, in other words. Two, these bacteria keep your vaginal pH acidic. I've talked about this in a previous video, but essentially recall that pH scale from 0 to 14, where 7 right in the middle is water, and that's neutral. 14 is very, very basic, think like milk of magnesia. And then if we go all the way down closer to like 1 and 2, 0, that's more acidic, that's more like vinegar. Your vagina is naturally acidic. It's naturally in that like 4.5-ish range. And you want the bacteria that live there to maintain this pH balance, because throwing off the pH can result in infection, like yeast infections or bacterial vaginosis. The other really important roles that the bacteria in your vagina play is that they produce a natural antibiotic. The fancy word is bacteriocin, but essentially these bacteriocins or natural antibiotics probiotics help fight off unwanted bacteria and help prevent infection. Finally, the bacteria living in your vaginal canal also help to kind of line the vaginal wall, that tissue, so that unwanted or bad bacteria can't stick to it and can't go invade nearby tissues. So the bacteria that live in your vagina are super important, and they are really, really happy and healthy and good, and you want them to be there. So when we talk about cleaning our vaginas, we have to keep in mind, 1, we don't want to wash away any natural lubrication. 2, we don't need to get deep into the vaginal canal and scrub because we have glands that produce secretions that do that for us. And 3, we don't want to disrupt that bacterial environment. We want to keep our bacteria happy and healthy. So what is the best way to clean your vagina when considering all of these things? Water. Just a splash of water. The actual vagina itself only needs a little splash of water. It doesn't need to be scrubbed with soap. It doesn't need to be wiped with a vaginal wipe. It doesn't need a product that claims to restore its pH. It doesn't need to be douched or anything of that nature. Often what will happen is a well-intentioned woman who's hoping to just clean her vagina will end up stripping the vagina of 1, all its natural lubrication leading to dryness, and 2, all of the good healthy bacteria that live inside it when she douches, when she scrubs with soap and water, especially using soap that has any sort of irritating chemicals or dyes, especially dyes, or the vaginal wipes or that spray. Instead of cleaning the vagina with these products, what tends to happen is the vagina's pH is thrown off balance, and then this poor woman ends up with some sort of yeast infection or bacterial vaginosis or a decreased ability to fight off bad bacteria and some other infection instead. So we've discussed how the vagina itself only needs a little splash of water. The vulva now, the skin around the vaginal opening, that we can use either a very, very, very gentle soap with no added chemicals or dyes, or water. I'm on board for just using water in this case, especially if you have any sort of history of vulvar irritation. Generally speaking, nobody needs to scrub. Nobody needs to get in between their lips of their vagina, their labia majora and minora, and scrub. Nobody needs to get into the vaginal opening, the actual vagina itself, and scrub. Instead, what can be used here in the skin is just some gentle patting. If we check back in with our picture, what I'm talking about is in between the labia majora and labia minora, the outer and inner lips of the vagina. If you do want to get a little bit more specific with your cleaning, you could spread the lips and get that kind of skin that lives in between the two. I wouldn't recommend using soap. If you are going to use soap, very, very, very gentle soap, but just a gentle pat with a washcloth is all you need in this area. The same thing can be said for drying off. When you're drying off your vagina and your vulvar skin, you don't have to scrub, scrub, scrub. You can just do a gentle pat dry. And then if we're talking about like the crease where your thighs kind of meet with your pelvis, that you can wash with soap. But since you're pretty close to your vulvar skin, again, if you have any history of irritation, I would stick with a really mild, gentle soap with no added chemical fragrances and no added dyes as well. So to recap, no, you do not need to douche, you do not need to use vaginal wipes, you do not need to scrub with soap and water, and you do not need to use any sort of vaginal deodorant spray in order to keep your vagina clean. As an aside, something that I run into with my patients sometimes is I'll have a woman share with me that the reason she douches is to prevent both infection and also to prevent sexually transmitted infection, to prevent STIs. It's important to me that you know that there is no evidence whatsoever to support that douching helps prevent infection or STIs. We actually have some research that may indicate the opposite is true, since you're stripping your vaginal bacteria of all of its ability or some of its ability to produce those natural antibiotics that we were talking about earlier. So let's talk about other super healthy and good vaginal habits for a happy, healthy, clean vagina. Super good habit number 1 is after any sort of vaginal penetrative intercourse, it's a really good idea to go pee, especially if you have any sort of propensity for getting urinary tract infections or UTIs. Let's go back to that picture really quick. So most UTIs are caused by E. coli, which is a bacteria that lives around the rectum. and somehow, some way or another, the sweat that is around the anus or the rectum will work its way up towards the urethra, and then we end up with E. coli entering into the urethra and essentially going up the urethra into the bladder, making a home, and then you get a urinary tract infection. Vaginal penetrative sex can cause some rectal sweat, some anal sweat to work its way up towards the urethra, and then you're at more of a risk for a UTI. And so one great habit that you can get into is peeing after this type of sex so that you essentially flush those bugs down before they've gotten a chance to climb up. For the exact same reason, removing a wet bathing suit or really sweaty gym clothes promptly after you do not need them anymore is also a really good habit. Instead of walking around in a wet bathing suit or walking around in really sweaty gym clothes for a while, take them off, put on something breathable, or if you're in a place where you can just hang out bottomless, hang out bottomless. Another really good habit, if you're in a place where you're comfortable doing it, is at nighttime, sleep without underwear on. Let your vagina air dry. Finally, if you're already experiencing some sort of vaginal irritation, a couple of tips for you. One, try to avoid any products that have any added fragrance or added dye, and this includes underwear. So as far as what underwear to wear if you're already irritated, stick with cotton, stick with really loose, breathable underwear, and try to get underwear that are either already white or that little piece of fabric that kind of lives in the crotch area. Make sure that that's white so that there's no added dyes irritating an already irritated area. Make sure that you are avoiding pools. Chlorine can dry out the vagina, and if your vagina is already irritated, you want to encourage that natural lubrication, not take natural lubrication away. And finally, if you need some sort of soothing, some sort of like good relief, aloe vera, pure aloe vera, can be very safe and soothing, as can coconut oil, almond oil, olive oil. Any sort of oil that you are already using on your skin could also be a good soothing, relieving treatment for an irritated vagina. Just rub some on your wrist and forearm of either the aloe vera, the coconut oil, whatever. Make sure that this part of you can handle it without any sort of adverse reaction, and then it should be pretty safe to rub around the vulvar region. Thank you so much for watching. Please, if you have any questions regarding this topic, or if there's another topic surrounding pelvises that you would like to see me talk about, comment in the comment section below. Also, if you want everything that I said in article text form, I did write an article about this, and there is a link to it in the description below. Also, if you have any sort of long-standing hypersensitivity around the vagina or the vulvar skin itself that makes inserting tampons painful and difficult, that makes tolerating medical pelvic exams like at the gynecologist's office really painful and difficult, or that makes penetrative sex or even oral sex painful, please don't hesitate to see if pelvic physical therapy is right for you. Inserting tampons shouldn't hurt. Medical pelvic exams are uncomfortable for sure, but they should not be excruciating. They should not be very, very painful. And sex should feel good. If none of these things are true for you, you may be a good candidate for pelvic PT. There is a link to a pelvic physical therapist directory in the description below, so you can go check that out if pelvic PT sounds like it would be right for you. Thank you again so much for watching, and have a wonderful rest of your day. I will talk to you guys later. Bye.